Hi, my name is Dr. Don Buford. This brief presentation covers how we're currently doing ultrasound-guided plantar fascia injections at Texas Orthobiologics. We prefer a medial approach for reasons that we'll discuss in this following presentation. You can see this video and other videos at our YouTube channel, which is at Dr. Don Buford. So let's go through some basic plantar fascia statistics. About 2 million people a year get diagnosed or treated every year in the United States. When you look at the overall population, about 10% of people will develop plantar fasciitis in their lifetime. This is a brief schematic showing the anatomy in the long axis and in the short axis. In the long axis, you can see that the plantar fascia comes off the calcaneus uh, uh, deep to the fat pad. And in the short axis, you can see a similar arrangement. And these are important views to be able to master when you use ultrasound to guide your injections. I have 5 reasons why we believe the medial approach is better than going through the sole of the foot. Number 1, it avoids the plantar fat pad and nerve complications. Number 2, there's better visualization of the medial calcaneus. Number 3, we have better visualization of the plantar fascia origin. And number 4, we can have precise in-plane and out-of-plane targeting of the plantar fascia. And then number 5, it's typically a less painful procedure compared to the direct sole of the foot. These are our basic ultrasound guided steps. We identify the plantar fascia origin in long axis. We identify the plantar fascia origin in short axis. Then we anesthetize our injection site with 1% lidocaine. That's just a couple cc's. And then we usually start with the short axis view to place a 25 gauge needle. And in this case, we'll inject 3 cc's of PRP that we've made from a 120 cc blood draw. So this is a very concentrated high dose injection in a relatively small volume. And so you can see here, we're first looking at the long axis view. This allows us to determine right where the origin is of the plantar fascia from the calcaneus there. We use our surgical marker to make a vertical line right there. And then the next step is to go ahead and look in the short axis view. And this allows us to measure the depth of our target. So we can see the plantar fascia, which is just superficial to the cortical margin of the calcaneus there. We can look at the ultrasound window and see our depth. So if that depth says, for example, 1 centimeter or 1.5 centimeters, we can make that mark. And where those 2 purple lines intersect, that is our injection site. So we can be very precise. And then, of course, we can fine tune this under ultrasound guidance. But you can see how we can measure that. And so the first thing we do is we go ahead and anesthetize that injection site with our lidocaine. And then we go ahead and take the needle. Here you can see a 25 gauge needle coming in from the medial side. And in this example, we're just superficial to the plantar fascia. We will go just superficial, a little bit into the fascial origin. We'll go all the way over to the lateral side. And the key is we have fantastic in-plane visualization of a 25 gauge needle to do this injection. So here's some additional references, and thank you for your attention.